I do want to bring up a fellow pharmacist and a very pretty lady as well. We're keeping the heart about pharmacy. Thank you, guys.
Now we gotta switch. That's quite the lead-in after we just talked about Sam and John. Thank you, Denise.
You're welcome.
We're getting tons of questions and tons of great responses on the Ustream. So.
Yay.
All right, perfect. Well, one of the things that Ben just talked about, what's important for a healthy life, is to move. And I know we've been sitting here for a while, so I want everyone to stand up. Okay, so just trust me with this. I swear it's going to work. So put your elbows at your hips, your palms face down, and you're going to take your opposite knee and touch your, so take your right knee and touch your left hand. And so you're going to just stand up and cross. And you're going to do this until you've done it for 20 times. And take some deep breaths in. What you're actually doing right now is recalibrating the left side of your brain and the right side of your brain. So we've been kind of heady with a lot of concepts, and now you've just kind of recentered yourself. So I'm going to take a deep breath in and let it out. And pretend you're
We're on
sitting
to the bathroom now.
So as Ben so eloquently alluded, my name is Heather Seashore. I live down in Littleton, Colorado. I am a clinical pharmacist at Porter Hospital. And this is my debut into speaking in longevity, and this has been a dream of mine since probably January. So I'm incredibly honored to be up here, and thank you, Scott, and Tom, and Denise, and just to work with such a fantastic group of people. So essentially, I was just asked to share my story. Now, why would a clinical pharmacist working in a hospital be with longevity, and why would I want to come talk to you guys about this? And so I felt like the best way to start is to just give a little bit of background of what is that I do in a day. So I have been at Porter Hospital for about 8 years. I studied pharmacy. I have a doctorate. I got really smart at what drugs do. And in the last couple of years, I've started touting myself as I'm the pharmacist at work that doesn't want anybody to be on drugs. And people look at me, and doctors look at me, and they're like, I kind of look like a heretic, you know? But I'm like Ben was saying, I kind of know how the sausage is made, and I don't really like it. So on a day-to-day basis, I work with people who have cancer. I deal with people who have knee replacements and hip replacements, people who are on the list to get kidney transplants and liver transplants, and I counsel them on their medications once they've had that. And the more and more I've started seeing it from a 10,000-foot view of what this healthcare system is doing to people and being introduced to what longevity is doing for people, I've kind of realized that there's a disconnect. And so actually I'll never forget the date. It was March 15th, and I get a call in my office from a cardiologist, and he says, hey, Heather, I need you to come to the ICU, and I need you to counsel this patient on Coumadin. So as Ben just talked about, Coumadin, not an awesome thing to be on. Raise your hand if you've ever been on Coumadin, know someone that's on Coumadin, heard about Coumadin. And keep your hands raised if it's something you'd be really excited to be on. Right, okay, so here I am, I've got this spiel, I've done it probably, hundreds of times, and I'm telling him, here's the things that you should watch out for. These are all the drugs it's going to interact with, and I start my laundry list, and I said, here's all the things you should think about if you have too much and you're going to start bleeding, and here's the things you're going to worry about if you start clotting. And part of this spiel also is what supplements and over-the-counter products are on that's going to interact. And it's like a lightning bolt could have come through the room, struck me on the head, and I could have fallen on the floor. I'm thinking to myself, I'm telling this person to stop taking his supplements so that he can continue to take his Coumadin. And I'm like, how does this make sense? And so right then and there, it was like a defining moment. And like I said, I won't forget it. I looked at him, and I've got this internal dialogue in my head, and I've got words coming out of my mouth, this multitasking at its best, I guess. But I finally was just like, I'm telling this guy to be on a medication, and this is kind of where I'm at with the healthcare system right now. Until your physician or your healthcare provider tells you to get a medication, there's never a plan when they give that to you of when you'll ever be off of it. You'll be on this for the rest of your life, and likely your doses will increase, and then you're going to need more medications to treat the side effects of the one that I just gave you, and you're creating this money-making, healthcare depressing, I guess, system. You're not giving people hope, and so that's kind of where I was just like, that's it. So what I realized I could do is I could promote something that's actually going to treat the root cause of somebody's problem. Ben talked about our health and our bodies, our systems. And I have arguments. I had an argument yesterday with one of our liver surgeons because he has a patient come in and the guy's gallbladder's inflamed. He's like, oh, we're going to take it out. Or, oh, you're going to appendix inflamed. Oh, we're going to take it out. Nobody ever thinks about what could be causing that. Like, what is going on with the immune system? What is this person eating? What is their stress level like? Like, there's not a holistic view of what's going on as a person. You're looked at as, you have a gallbladder, let's rip it out. And we're going to put you under surgery. And then we're going to put you on a blood thinner medication. And then we're going to put you on pain medication. And then we're going to, it's just like it's on and on and on. And so the cool thing about longevity, and especially Dr. Wallach, is he's figured out this system. He's basically taken the medical model and turned it on its head and said, there's a better way to do this. And let's give the body the fuel or what it needs so that it can operate in all cylinders instead of treating all these little symptoms and looking at people as specific organs or ways of you come in with a symptom, we're going to run an MRI, we're going to do some x-rays, we'll throw some medications on you until we can give you a diagnosis so you can put that in your pocket and make yourself feel better because now I've got fibromyalgia. Even though I know that my muscles hurt when I walked into the doctor, I just paid you $300 to tell me that. But longevity could actually provide a way to treat, well, why are your muscles sore? What are you deficient in? What could you be treating to get you back to optimal health so you can go be productive and live a great life and do what you want to do, not be a victim to your diagnosis. And so essentially, that's kind of why I'm here. And I love being able to provide messages of hope and to come from the other side of the industry and know what I know and know that it's not working and not even be able to project what's going on in the future with Obamacare. That's a whole other topic. But to be in a great company that actually cares about people's health, you're actually going to be able to make a difference in people's lives. And just a nice little bonus is that you'll be paid to do so. I can't think of a better place to be. So with that, thank you so much.
She had a tall drink of water. Look at that. Unbelievable. Heather is a rock star. And thank you. And it always astounds me. I was telling Greg, it just amazes me when smart people believe this stuff. That is so awesome. All right, you got it.